Welcome to another episode of MedTalk. Today we have two distinguished guests to discuss breast cancer. First guest is Jigisha Kothari, who is an executive member of Indian Health Camp of New Jersey, a non-profit organization, and previously worked with New Jersey Cancer Education and Early Detection NJCEED program at Morristown Medical Center for 15 years. Jigisha has been a champion in outreach and educating South Asian community for early detection and providing breast self-awareness cards and video. She was a recipient of the Humanism in Healthcare Award in 2013 from the Healthcare Foundation of New Jersey. Welcome, Jigisha, to MedTalk.
Thank you so much for that generous introduction. I'm honored to be here.
Thank you. Our next guest is Dr. Muhammad Abbasi, who is an oncology and hematology specialist in private practice in New Jersey. Previously, he was the faculty and chairman of Quality Improvement Committee at Montefiore Medical Center and Albert Einstein College of Medicine, and assistant professor at Jacobi Medical Center. Both of these guests have worked tirelessly in improving cancer care by providing education and community outreach activities during their entire career. Welcome to MedTalk, Dr. Abbasi and Jigisha Kothari.
Thank you very much. I appreciate the opportunity.
As we all know, October is an important month for women as it is celebrated as Breast Cancer Awareness Month. And I want to appreciate you both for coming to MedTalk and give our viewers basic understanding of breast cancer in a lay term so our audience can understand the importance of early screening and detection and prevent complications and favorable outcome from cancer. So let me start by asking a first question to Jigisha. How common is breast cancer in the USA?
There are about 256,000 women diagnosed with breast cancer every year, and it's projected in 2020 over 275,000 women will be diagnosed with invasive breast cancer. And we would like to bring this mortality rate down by early screening and early detection. Usually there are about 42,000 women die of breast cancer during a year.
Yeah, I think I would just like to add, this is something which is very important to understand, that a lot of people don't realize how common it is. So just to give an idea, 1 of every 8 women in the US in her lifetime will develop breast cancer. And the other thing which is very important for the community from subcontinent or from outside US, that when they move to US, they still feel that this cancer is not going to happen to them because incidence is not as high in India or subcontinent. But very important to realize that there have studies shown that people who relocated to US, their risk of cancer developing is almost same as the US population. So don't be in that cocoon that, okay, we are fine, we don't need mammogram or whatever. It's very common. So it's a very important point to remember. And 270,000 women is a big number. So just keep in mind that.
Very important talk you say about these stats. Yes, wonderful. Can you tell our viewers what are some of the symptoms or warning signs of breast cancer? And I'm going to start with Jigisha asking that question.
Many times women are afraid to do self-awareness, to do self-exam of their breast. Mainly the lump. Not all lumps are cancer or dimpling on the breast. When if one breast is heavier than the other breast, the size of the breast changes. Many times nipple is inverted. There is bloody nipple discharge. These are main signs of breast cancer, but all of them are not cancerous, but they are signs of cancer. So I don't want women to be alarmed or panic if they have any of the symptoms, but they do need to call their doctor right away.
Yeah, I agree 100%. And just want to add again one more point, that just remember that majority of the people don't have symptoms. So if you don't have a lump, doesn't mean that you have to. Key thing is to pay attention to what are the guidelines, what are being told by your primary care doctors when to get mammogram. Because if you don't have a lump or you don't breast looks normal, that doesn't mean that you're all okay. In fact, more recently, American Cancer Society have discouraged to base your self-examination is not encouraged because a lot of people don't have understanding what does self-examination mean. So more than self-examination is self-awareness, as Jigisha mentioned,
Right.
to make sure now and then look at your breasts, make sure they're symmetrical. There are no, unfortunately, because cultural biases and stuff, women don't even do that. I mean, they just don't even hide from somebody else, but even hide from themselves. So that's very important to remember, that there may be no symptoms. Self-awareness is very, very important.
Yes.
So be aware of how old are you. Because women don't want to think about it, but at some point you have to think about it. Okay, how old are you? So have to pay attention to your age and accordingly do proper things, as Jigisha mentioned.
Excellent points, both of you. So can you share some light on risk factors, specifically who are at risk of getting breast cancer? This question is often asked during our health camps and many other places. So I would like to hear from both of you, and start with Jigisha first.
As women get older, first of all, the risk goes higher, and family history of breast cancer also play a big role. So I would like to encourage women to talk to their mother side of the family as well as father side of the family and learn if anyone has had breast cancer, if they have personal history of breast cancer, their own medical condition plays a role as well. And if they have BRCA1 or BRCA2 mutations, they are at a higher risk of getting breast cancer.
Yeah, so just to add again, the basic points Jigisha mentioned, but very important, a lot of people pay attention to genetics and say, oh, I don't have any family history or genetics, I'm okay. No, actually, 85 to 90% of patients who have developed breast cancer don't have genetic or family history. So don't be fooled by thinking, oh, I don't have any family history, so I'm okay. It's not like that, because majority of people, only 10 to 15% of patients have genetic mutations. So that's number one point. Secondly, there's not consensus on that, but there's some hints toward which are the patients that increase risk. For example, people who never had pregnancy, or who have late pregnancy, or who never breastfed, these are the patients who are increased risk. Even birth control pills, I'm not scaring people, but there's a small risk. So when you take those pills, make sure, discuss with your physician. Most of the time it's safe, but if you have some combination of factors, maybe you think twice before doing that. So age, anybody who's age 65 or over is automatically a risk factor. So that's something which keep in mind. As Jigisha mentioned, previous history of cancer, family history, very important. Even if genetic test is negative, if you have family members, especially first degree relatives, your parents, your siblings, or your children, God forbid, then you pay attention to those numbers. So it's a combination of things. People who are obese, that's a risk factor, because obesity have some diet, has some inclination, activity. So all these things are in combination, and we are from what subcontinent or from India are not immune. A very important point to remember that the genetics are not the major contributing factor.
Wonderful. Thank you
And
so
I
much.
wanted to add just a couple of things. Women's menstrual cycle, if they have had their menstrual cycle starting under the age of 11, they are getting breast cancer because they are really exposed to estrogen at a longer period of time. And secondly, if they go into menopause over 55 years of age, they are at a high risk of getting breast cancer. And one more, if women have had first child at age 35 or older, they are at a higher risk of getting breast cancer as well.
Yeah, very good point. So we call them in medical terms, doctors, as Jigisha mentioned, estrogen years. So longer the estrogen years you're exposed to, more. So early menarche means early period and late period ending. There are many years in between you are exposed to hormones without counter hormones. So that's why pregnancy sometimes is protective. The more children you have, the less likely chance that you have. But again, that's not the only factor, but something to keep in mind.
Right.
And that may be one of the reasons in the Southeast Asia, especially in East Asia, the cancer risk is not as high because women have more children and they have lactation. They breastfeed their children more often.
So thank you so much both for that description of risk factors. So Dr. Abbasi, like cardiac disease, can a woman change some of the risk factors by modification of lifestyle or diet? Can you also give some advice on what proactive steps women can take to reduce their chance of getting breast cancer, and what can women do to avoid their risk?
Yeah. So I think I'm talking to very particular audience right now, but this advice is for the population in general, but specifically for Southeast Asian or subcontinent sisters, is that first important thing which Jigisha mentioned already is awareness. It's very, very important that you're aware of your own lifestyle, aware of your age, aware of your surroundings. So don't discount your family history, don't discount your surroundings, don't discount your own health. So to answer your question, like cardiac patients, I advise them, cholesterol should be low, exercise. In fact, studies have shown women who exercise regularly have less likelihood of cancer, breast cancer especially, but all the cancer. Secondly, obesity. Make sure don't gain weight, or even if you have, just that can be controlled. So lifestyle changes, diet, for example. More diet is well known now. The diet high in fibers, especially fruit and vegetables, is protected. So if you are a meat eater, balance it out because too much meat is not good. So those are some of the lifestyle changes you can do. I think more importantly is that awareness to me, because a lot of people deny this. They age 55, 60, and they still never had a mammogram. So I think most important thing that you can prevent the breast cancer, or even if you catch it so early that it's so tiny that you can't even feel it, is to do mammogram on timely basis. So I think that's the very most important advice, more than anything, is to be aware of your age, aware of your surroundings, and do proper screening. So that's the best way to prevent the cancer. Of course, as I said, exercise and diet and the weight, these are other common important factors.
So October is Breast Cancer Awareness Month. Screening and early detection is the key in reducing the complications of breast cancer. What are your recommendations, current recommendations for the screening for general women, general individuals in the community?
I can start with that. So there are very specific guidelines for these, and there is some controversy about what age to start with. But general consensus are between 40 to 45 age you start with. Of course, if somebody has a strong family history or personal history, then you age is earlier than that. But generally, age 40 to 45, and after that, you start yearly mammogram up to age 55. And after 55, the age limit when to end is a little controversial, but also up to the patient's age and other comorbidities and other symptoms. Generally, 65, 75, 70, depending on how healthy the person is. So, but after 55 to 65 age, people do once every 2 years. But starting point is 40 to 45, and after that, once a year. That's the mammogram recommendation.
Wonderful. So, piggyback question for Jigisha now. What kind of screening tests are available, and what are some of other measures women can take to detect breast cancer earlier besides getting the routine mammograms? Is there anything else they can do?
Yes, as you mentioned, the key is to detect breast cancer early. And how do you detect breast cancer early? What can you do? What are you thinking about? So mainly, as Dr. Abbasi mentioned, that breast self-awareness is extremely important. How do your breasts look and feel? You have to remember, how do they look and feel? So when you are in front of the mirror after you take a shower, look at your breasts and see if one breast is heavier or swelled up, or if there's any redness or any changes. So you do need to know how your breasts look and feel. So if you are doing that every month, that's wonderful. You do need to do that every month. Secondly, clinical breast exam. So by a professional, by your healthcare professional or a nurse, need to do clinical breast exam. I do advise women to have a primary physician and a gynecologist and have those appointments 6 months apart. So you can have clinical breast exam twice a year rather than just once a year, because they have very, 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 very experienced hands, and they can press where they want to, because they do need to press underneath your underarms and your breast. And you do need to use your right breast for the left side and left breast for the right side. I understand, Dr. Abbasi, that we don't want to alarm women and say do breast self-exam, but breast self-awareness comes with how they feel and look. So I do mention that to women because our women really don't want to do that. They say, oh, my breasts are fine. I had mammogram. So I'll get to that third point, having mammogram, as Dr. Abbasi mentioned, once a year, because mammogram can detect a lump in your breast when it's very, very tiny. And if you know your breast, you can find a lump this big, or if you don't know your breast, you can find a lump this big. So you don't want to be at this stage. So I would like to encourage women to know your breast, get a clinical exam, and get a mammogram after age 40 every year.
Wonderful explanation, Jigisha. So I want to go a little deeper now into clinical aspect of breast cancer. And Dr. Abbasi, so if the woman has an abnormal mammogram, is it always a cancer or more diagnostic testing is required? And what kind of tests are available to detect breast cancer?
So yeah, that's a very good point that you brought up, because a lot of women think, oh, I don't want to go to mammogram because you'll find something and it will be cancer and I don't want to deal with it. Something that kind of, even if they don't say it, express it in the back of their mind, they're going to find something, and it's not like that. Mostly nowadays, there's years and years and thousands of women who have gone through the mammogram. They have very experienced radiologists. So they can look at it and they can tell whether this is something serious or this is benign. So many times when they do the mammogram, radiologists can tell off the bat, okay, this looks very benign, don't worry about it, let's do another mammogram in a year from now. But just like we know from our common knowledge that cancer is aggressive many times and it's become irregular. So when the radiologists see the mammogram and they see a lesion or spot in the breast, but it's not round, but irregular looking, that's one of the telltale of maybe potentially a cancer. So then they lead to the next step. Generally, after mammogram, they have other tests, for example, ultrasound or MRI, that will further confirm whether it is truly something more suspicious or if something can be passed. So first step is with the mammogram. If the radiologists feel that this looks suspicious looking, the next step they ask for the ultrasound or MRI sometime, and even still looks suspicious, then they do the biopsy. And biopsy is the key, actually. You cannot say somebody for sure 100% has cancer through the biopsy. And biopsy is a small procedure. They do a needle. It's not an open surgery. And they can take a sample out of it. Nowadays, mammograms are also, like probably people have heard about 3D mammograms. So they are more sophisticated kinds of mammogram, which can give you a more clear picture to radiologists to come up with the suspicion of how suspicious it is. So not always sure. Most of the women actually have benign condition, fibroadenoma, cyst, whatever. And they are very clearly, they can tell most of the time on the mammogram that it's not cancerous, and just pass it on to the next year.
So when I was in medical school, Dr. Abbasi, 40 years ago, breast cancer was like a death sentence. Is breast cancer treatable now? And what are the treatment options in 21st century? It should be something advanced than 80s or 90s.
Yeah, sure. You look 40 years. You look 40 years ago. You look 40 years old. So you look very young. So no, I just have to make it a little light because it's serious talk. So I hope people don't mind. But I think things have changed dramatically over decades. And I'll tell you, within my experience in my career, from when we were doing chemotherapy all the time, now many of the cancer treatments are moving away from chemotherapy. It's called more targeted treatment. So it's a very important thing which I want to pass on to my audience today, that cancer is not a death sentence. It's very, very important. Breast cancer is actually one of the most curable and treatable cancer. So we have, I can go into a little bit more detail about the cancer treatment. So breast cancer, for example, has 4 options of treatment. Cornerstone of the breast cancer is surgery. The first step is always, most of the time, not always, but most of the time, it's surgery. The next is radiation, chemotherapy, and the pills. So these are 4 treatments available. Some patients need all 4 of them. Some need only surgery. Some need surgery plus radiation. So depending on how big is the cancer, how big is the situation, how advanced the disease, we use different combinations. And even chemotherapy nowadays, honestly, most of the people even work while they're doing the chemotherapy and going through this. So it's absolutely this kind of a taboo that, okay, chemotherapy goes on and you're going to lose your hair completely and you're going to be completely out and not be able to do anything. Absolutely not. That's not the case. So it's something which is very important. Of course, people who don't see or know about cancer, they will have this fear. But I think it's very important to awareness. That's why this is Breast Cancer Awareness Month, that people should know this is not a death sentence.
Wonderful explanation, Dr. Abbasi.
So I wanted to,
go ahead.
I wanted to add something about mortality rate. When you asked the question to Sharbai that what are the treatments and what are the changes now in many, many years. So Dr. Abbasi mentioned over decades, 40% of the mortality rate has gone down since 1989. So from 1989 to 2017, we have reduced the mortality rate to 40% with breast self-awareness and treatments.
So we talked about the diagnosis, we talked about the screening, we talked about the treatment now. So Jigisha, access to care. Many times, a lot of immigrants in this country who don't have basic insurance for the screening. Does insurance company covers for the screening who does have insurance? And what about the woman without any medical coverage or insurance or no Medicaid? What happens to those individuals? I know sometimes it becomes very tricky for those individuals.
Yes, so women who have insurance companies are mandated to cover mammograms every single year. That's a screening tool we have, and insurance companies do cover that. Affordable Care Act, when it started in 2010, for women who have Affordable Care Act, under that act insurance, those insurance companies do cover mammogram as well. Now, women who don't have insurance can call Susan G. Komen for the Cure hotline, and they can find this Susan G. Komen for the Cure affiliate in their area, and they will direct them to a center where they can get a mammogram. Secondly, New Jersey has cancer education and early detection program, and that program accepts women who are underinsured and uninsured, and if they have low income, they can get free mammogram, they can get free ultrasound, doctor's consultation, free surgery, and they can be given Medicaid in New Jersey. Now, breast cancer and cervical cancer early detection program nationally, BCCE has a lot of resources. Any other state, if they go to that website, bcce.org website, they should be able to find nearby healthcare facility where they can get free mammogram if they are low income.
So does that cover if they have any abnormal screening? Who pays for the further diagnostic studies and treatment?
If they are screened through New Jersey CEED program, meaning Cancer Education Early Detection Program, or BCCE program, Breast Cancer and Cervical Cancer Education Program, they are automatically covered with mammogram, ultrasound, diagnostic testing, and doctors' surgical consultations and surgeries if they have low income and if they qualify. If they don't, sometimes women don't qualify because they are at above certain threshold on income, then Susan G. Komen for the Cure affiliate can find them a center where they have funded specifically for those women who fall over the guideline, the poverty guideline through these programs. So it's very important to go to komen.org or call Susan G. Komen's hotline number, which is 1-877-GO-KOMEN, 1-877-465-6636. Komen has 120 affiliates around the country, and they will be very, very happy to help our women.
Yeah, I think it's a very important point that Jigisha is making, that there are resources. We just have to be a little bit proactive, because nowadays, luckily, we have internet, we have so many resources that you can find. So it's just a matter of either the person herself or her family members. Now we have children who are very internet savvy, so it's just a matter of telling them, looking it up. You'll find so many resources. American Cancer Society is another resource where you can get help. So I think help is available just because you don't have insurance. And I, being a private practitioner, I can, Jigisha knows about this, that I don't have obligation to do that. But as a practitioner who practicing in a certain area location, is our obligation to give back to the community. So many of these doctors, like my partners and many other doctors, I'm not the only practice, who are willing to help people like this, to see them and use the resources through the hospitals, through the government services to help these patients. We have several examples. Jigisha knows, we used to work closely before. There's so many patients who have no insurance and they are cured. They're doing very well. So just that the fact that you don't have insurance, don't think that nothing can be done. Plenty is available. It's just a matter of finding the resources, and it's easy, it can be found. It's just a matter of making a little effort.
That is true, Dr. Abbasi, because women who don't have insurance, there are only 40% of women getting mammogram every year. And people who have insurance, 75% of those women are getting mammograms. So we do need to advise and actually make these women aware that there are resources available statewide, locally, as well as statewide and nationally. So I just hope that you do take initiative to look for them.
Just one point I want to make, very important, again, specifically for Southeast Asian women, but generally all mothers are like that. And as you have examples from your own mothers and my mother, and all of us know very well, mothers are the last person who worry about themselves. They take care of the whole family, the dinner is served, everybody eaten, and the mother is the last one who will find something for herself. So this is a common cultural thing, which is very good actually, but we have to be very aware, especially our children, that make sure that their mothers are not ignoring themselves. Because many times that's what they're doing. They're taking care of everybody else, and then themselves they're not worried about or not taking care of themselves. So if you're listening today, any children, daughters, sons, make sure, go home and check on your mother. When was the last time she had the mammogram? Yeah. When was the last time she seen the doctor? I think it's very critical because they just hide, and whatever cultural reason, first of all, they don't even talk to their husband many times about what's going on with them. Forget about talking to the children. So I think that's a very important message I want to put across, knowing what I know about our culture, that's what people can do. So just important point to remember.
Let me also mention one more phone number for New Jersey State. It's New Jersey SEED program, 1-800-328-3388. Please call that number if you are in New Jersey. And if you are out of New Jersey, please call Coleman's phone number, 1-877-465-6636.
So Jigisha, is the SEED program available in any other states besides New Jersey?
Yes, it's called a breast cancer and cervical cancer early detection program, called NJCEED.
Wonderful.
Available in every state. Thank
you so much both for providing that resource information. So any departing comments, take home message, and I'm going to start with Jigisha, 1 minute. Any message you want to give to our viewers regarding breast cancer, screening, awareness, how can they help themselves?
Breast cancer can be detected early. Please don't panic. If you feel anything, please call your health care provider as soon as possible. All men, as Dr. Abbasi mentioned, all men do need to be vigilant. Men do get breast cancer. About 2,600 men got breast cancer last year. 500 men passed away of it. So I would like to mention that men do get breast cancer, and women, please take care of yourselves. And men, please ask your mothers, sisters, daughters, and wives, encourage them to get a mammogram and ask them to take care of themselves. Thank you.
Dr. Abbasi.
Yes, thank you. So yes, screening is absolutely paramount important because the cure is to find the cancer early. If you found the cancer very late, it still can be, but you have to go through a lot. compared to going to very little, as Jigisha showed that a bead with a small versus big size. So it's very, very important to catch it early. The key thing is screening. But I want to point out one very important thing. Even if you develop cancer, as Jigisha mentioned, of course, something needs to be done, but it's done very methodically, and a lot of resources and things are available to still cure patients. So even if you develop one, sometimes people develop lump and they keep ignoring it because they don't want to deal with it. Don't do that. That's the worst thing you can do, because catching it early. And we have so many patients who've gone through this journey, and the journey can be done with a great effort, but at the same time, the result, the reward is very, very great at the end. People can still be cured. I just would like to mention, one of my patients wrote this book, which I want to show right here. It's called Again. So this book is all about her journey through cancer. And this book, basically, she tells about the story, how she went through detection, to treatment, to surgery, and the cure. And she's doing great right now. So there are patients, you'll find plenty of resources like this one. When you, even God forbid, if you have cancer right now, you're thinking about it, what to do, there are many things can be done. So I think it's very important to remember, we are blessed to be here in this country where so many things can be done. And we should be a little smart enough to use proper resources and timely basis.
Thank you so much, Jigisha and Dr. Abbasi, for coming to MedTalk. The month of October, very important month for women, breast cancer awareness month. You provided excellent information on screening, diagnosis, and treatment, and other resources available for the women to get cancer detected early. Wish everyone a happy and healthy fall and winter. And thank you so much for your time again.
Thank you.